One of the most common questions people have is, should I go to the emergency room or should I go to urgent care? And honestly, after more than 25 years in healthcare, I understand why people get confused. Healthcare has become complicated. Not everyone has a primary care provider, and not everyone can get an appointment. And when you're not feeling well, it can be difficult to know where you're supposed to go. So today, let's talk about it. Hi, I'm Kisha Pickford, a nurse practitioner with over 25 years of experience in healthcare. And on this channel, I share real talk about healthcare and the lessons I've learned along the way. Today, we're talking about emergency rooms, urgent care centers, and how to think about where you should go when you need medical care. I think one of the reasons this topic is confusing is because healthcare doesn't always fit neatly into categories. Sometimes symptoms are obvious. If someone is having severe chest pain or signs of a stroke, most people recognize that's an emergency. But what about abdominal pain, or what about dizziness, or what about a fever that just won't go away? What about a headache that feels a little different than the norm? That's where things get more difficult. A lot of symptoms can overlap between something minor and something much more serious. And that's why people struggle with this decision. So let's start with what the emergency room is designed to do. The emergency room is designed for conditions that may be serious, life-threatening, or require immediate evaluation. The ER has access to resources that many other settings don't. Things like advanced imaging, emergency procedures, specialists, hospital admission if needed. The goal is to identify and treat emergencies. Examples include chest pain, difficulty breathing, stroke symptoms, severe injuries, significant bleeding, major accidents. Those are situations where time matters. Now, let's compare that to urgent care. Urgent care serves a very important role in healthcare. It's designed for problems that need attention soon, but may not require emergency level resources. Examples include ear infections, sore throats, minor cuts, sprains, rashes, cold, and flu-like symptoms. Urgent care can often be faster and less expensive for appropriate conditions. And for many people, it's a great option. But here's where things get interesting. One thing I've learned over the years is that healthcare isn't always black and white. Sometimes people think they're coming in with something minor, and it turns out to be serious. And sometimes people think they're having a major emergency, and fortunately, it's not. That's why I tell people not to focus on making the perfect decision. Focus on getting evaluated when you're concerned. And that's where experience can make a difference. After many years in healthcare, I've learned something important. Most people are doing the best they can with the information they have. They're not trying to make the wrong decision. They're trying to figure out what is happening to them or someone they love. When people aren't feeling well, they become worried. And when people are worried, they want reassurance. And that's human. So how can you think through it? When you're trying to make the right decision about where to go, ask yourself, is this getting worse? Am I having trouble breathing? Am I having severe pain? Am I experiencing symptoms that seem unusual for me? Would I be worried if a loved one were experiencing this? These are questions that can help guide your thinking. But there is another factor we don't talk about enough. Not everyone has access to healthcare in the same way. Some people have primary care providers. Some people don't. Some people can get same-day appointments, and others may wait weeks. Some people work schedules that make appointments difficult. So when we talk about where people should go, I think it's important to remember that many people are simply trying to access care the best way they can. And that's why I try to approach these conversations with compassion. One thing healthcare has taught me is that education matters. The more people understand their options, the better decisions they can make. Emergency rooms matter. Urgent care centers matter. Primary care matters. Each deserves or serves a different purpose. So, if you've ever wondered whether to go to the emergency room or urgent care, I hope this conversation helped. My goal is never to tell people what they should have done. My goal is to help people better understand the healthcare system so they can make informed decisions moving forward. Well, I don't know who will see this today or years from now, but this is my story and this is my perspective. I'm Kisha Pickford. Thank you for being here, and I will see you in the next episode.